Stuart, just start off by telling us a little bit about yourself and how you arrived at Cooperative Health.
Oh, so, I am originally from Ohio, born and raised there in a housing project there in Cleveland. Came to South Carolina looking for residency for family medicine and ended up in Columbia, South Carolina. Initially, I was part of another health center,
Mm-hmm.
and sadly, we lost our funding. And Eau Claire, Stuart Hamilton was um, gracious enough to take us on under his tutelage and employ myself and many others. And so in 2012, I came to Cooperative Health and remained here throughout this time. And it's been an honor and a privilege to be part of the mission of Cooperative Health here.
Okay. And the federal government has designated the Midlands as a HIV hotspot. Tell us a little bit about how the HIV virus has infiltrated the Midlands region.
Yeah. So, sadly enough, HIV has impacted many areas that are considered rural, especially. And South Carolina is one of those, and we see a large number of new cases of HIV within our community. And what our job is to really get into being able to diagnose individuals and get them into care, get them into care rapidly, being able to recognize areas that may be more impacted with HIV than others, and then get to those populations that have been for so long not really looked upon as having HIV or even getting that treatment. And that is individuals who are ages 25 to 34, women who are African American, um, the what we call BIPOC, uh, Black, Indigenous people of color. Um, that have been truly unfairly and represented as far as HIV is concerned and being diagnosed and being able to get the care that they need. So, if we can get individuals diagnosed, get them into treatment, getting those individuals who are at risk, get them into prevention, then we could really have an impact within our community and stop HIV.
You mentioned a little bit about this, but expand a little bit more on Cooperative Health's role and your role specifically
Yes.
in combating the epidemic here in the Midlands region.
I am honored and privileged to be part of Cooperative Health because we make sure that we see individuals regardless of their ability to pay. We get them into care. Every individual, we make sure that we follow the CDC guidelines and also the USPSTF guidelines in getting people tested. Because that is the first goal, and get those individuals screened and tested. And so we have an opportunity to really have a profound impact within our community to get folks tested, get them treated, get them into care, and provide the best care necessary. In addition, not only with their HIV care, because we are primary care focused, we provide their care for diabetes, hypertension. And so we have the ability to really impact the health, the total health of individuals within our community.
Now, you mentioned testing. We're approaching National HIV Testing Day. Discuss the importance of testing in the overall treatment of folks with HIV.
Yeah. It's really important for everyone to know their status, number one. And the only way to do that is to get screened and tested. And for those individuals who are found to be positive, we need to get them into care and get them on antiretroviral therapies as soon as possible. And for those who are negative or who are maybe at risk of acquiring HIV, to get them on PrEP. And we have the opportunity to do that. Every office within our cooperative has the opportunity to prescribe PrEP, and it's really important that we do so. And so we have a great opportunity in our community to be able to impact HIV in our city and And when you look even further in our state.
Now, you mentioned at risk. Define who is at risk for contracting HIV.
So I really want to kind of take that back.
Sure.
I hate that term at risk because how do we determine at risk? People may be, more prone to be able to be impacted by HIV. And so we look at risk factors. And there's different ways to do that. We have guidelines we call the 5 Ps, looking at what they do for prevention, pregnancy, things like that we can assess. But the biggest thing is to have a conversation with our patient to see, whether they're having unprotected sex, whether they are IV drug user. We forget about individuals who inject drugs, and that is a growing population within our state. And we have to make sure that we test those individuals for HIV, because again, not only could they have hepatitis C, which is something else that we treat within our organization, but also HIV. And so having that conversation and talking about a patient and, ensuring that they recognize that if they need pre-exposure prophylaxis or if they need HIV treatment, then we have the opportunity to provide that care.
Okay, and lastly, the federal government's designated the year 2030 is hopefully the end of the epidemic. What do you feel are the next steps toward reaching that goal, or is that goal even attainable?
Yeah, it's going to be tough because we are already 7 years towards 2030. We still are seeing individuals who don't know their status. 1 in 7 individuals don't know their HIV status. And so those individuals could potentially transmit HIV to someone else. And so we still have a long way to go. We still have to ensure that we test everyone for HIV to ensure that those individuals who are negative at that time, that we provide PrEP. It is obtainable, but it's going to be a long fight. We still have to advocate for ensuring that those tests are paid for by the government. We have some court cases that we have to keep an eye out that are in other states, but they may trickle down to South Carolina. And so again, keeping those advocacy efforts up and ensuring that we can keep our population healthy, ensuring that we can get everyone who has HIV into care and keeping them, of course, virally suppressed, because U equals U. Untransmissible, undetectable means untransmissible, and ensuring that we encourage individuals to stay on their medications, to stay on their medicines.